While much of the collective work is focused on preventing vision problems from ever occurring, it is equally important to ensure that those who do experience them have support in enhancing their lives. Dr. Tracy Williams, a longtime advocate for low vision services, is here to share his thoughts on this important area of work. Dr. Williams is a nationally and internationally known low vision rehabilitation practitioner. In 1986, he was named the executive director of Spectrios Institute for Low Vision at the Deicke House, which is a nationally known accredited nonprofit agency with a multidisciplinary staff of 14 professionals who provide low vision rehabilitation to over 1,300 individuals with vision loss annually. Dr. Williams?
Thank you. It's so nice being here. I just want to say that anyone that cannot see any of the PowerPoints, I believe that Prevent Blindness America on their website in mid-July or so will have those. If I can be helpful at all, you can always be in touch with me at www.spectrios.org, and we'll get you an electronic copy. So what does Spectrios mean anyway? Well, Spectrios is a made-up name. Spec is for we do the full spectrum of comprehensive low vision rehabilitation. And Trios is our triad philosophy. We work on the head, heart, and eyes. Now, my staff likes to mess with me, so they put some pictures up here. For those of you that can see the pictures, there's a picture of a house. That's the setting that we actually work in. We've been at this, as you heard, since 1986. It's a working sort of environment. There's a picture of me with a child, just because I like to get across the point that while we hear so many people up in age that have vision loss, there's a lot of children with visual loss as well. We see about 350 children in the Illinois schools every single year and have done that for over 20 years, and that's only the tip of the iceberg. You see a picture of a baseball player. That's me, because my goal in life was not really to go in this field. It was to play for the Chicago White Sox. I came pretty close. I just lacked one thing, as Hugh knows, and that was talent. But I'll just tell you that the power of low vision is very, very powerful. In Chicago, I got the reputation of being able to squeeze every last ounce of vision out of people, so I was asked to be a doctor with the Chicago White Sox, and I'll tell you, I'm wearing a World Series ring, so you see, low vision is a very powerful field. My staff looked at all the other speakers here and they said, you are truly the Forrest Gump of this group. And I'll tell you, for me, life is like a box of chocolates, so we'll move forward. You know, it's a break being a later speaker because, first of all, you're pretty happy if there's consensus with all the statistics and they've identified what the problem is. And I'll just share with you, I had a great break working at the National Eye Institute, the NEHAB group, and low vision has been on the radar screen for some time. One of the things that I wanted to bring out, though, is I was a little stunned back in 2002 when the NHIS survey came out. It said 14 per 1,000 Americans aged 18 and older with vision impairment use vision rehabilitation services. And I have to say, what happened to the rest of them? The next part of it was, according to the same study, 22% of the people aged 18 and older with visual impairments use visual and adaptive devices. So that's a little higher. So that means they're pretty resourceful. They must be going somewhere to get these tools. The World Health Organization has been very involved in the low vision field as well. All right, so I think it's important to think in terms of what do the consumers say about low vision. And I can tell you, sitting in a lot of support groups, that they say things like permanent vision loss without a cure in sight. That might be a play on words. When you think, what is low vision? It's permanent vision loss without a cure in sight. For many of them, it's a life-changing event. And the final thing is, it's a catalyst for psychosocial disruption. I can tell you, working clinically in the low vision field, that if you don't focus on the psychosocial issues, a lot of the devices and technology ends up in the top desk drawer. I can tell you we were very thrilled at NEHAB when former director of the NIH, Dr. Zerhouni, stated, as our population lives longer, eye disease will be even a greater concern. And we've heard that all morning. I have a slide here. It goes back to 1975. It's from the U.S. Census Bureau. In 1975, I got married and graduated from college, and I thought, boy, this is really looking good. There's a graph up here with the tip of this tree being 85 and up, and the bottom of the tree just from birth. I was down in the lower half, that sort of 10 through 30 age group, now known as the baby boomers. Now, when you look at where they're saying we're supposed to be going by 2050, and we've heard this again and again and again, it doesn't look like a tree anymore. It looks like an inverted bowl. And we're seeing more and more people being pushed on top. I think the question is, will I be out of business then? Well, many of you would say, yes, you'll be a pretty old guy by then, but will low vision be gone, or will we have the cures that finally not make it so important? I hope so. I want to acknowledge I had the great opportunity last night to be at a dinner with the Prevent Blindness America board, their staff. I thank you so much for putting on this event. Hugh Perry's been a friend of mine for years. These statistics are so helpful, and I'm so glad that you know, we're recognizing what's happening out there. The consequences, we've heard over and over what the consequences are. I was so impressed with Dr. Frick years ago when he said that the economic burden to society is like $51.4 billion. I mean, hello, is there a problem out there? Why aren't we thinking not just about cures, but we have to think about how about these people and what's going to happen to them? I mean, do we just tell them, sorry, there's nothing more we can do and send them home? I think that there's so many negative effects on health. We've talked about this, their eyes, systemically. We've talked about what the societal implications are, employment, on and on this list goes. It's just a growing group. And just alone in the 2010 population in my state, there's about 13 million people. We're seeing about 40.3 million people 65 years and up. So we're seeing this aging process you've heard over and over again is happening. And with age, if you have vision loss, then we think about all these other issues. You've already heard me mention about depression, risk of premature death, increase of falls, admission to nursing homes, on and on the negative list goes. I was fortunate serving at the AOA in the low vision section that we wrote, What is Low Vision? And I think this first part is important. Vision rehabilitation is the process of treatment and education that helps individuals who are visually disabled attain maximum function, a sense of well-being, a personally satisfying level of independence, and optimum quality of life. Now, the part that's always attracted me to do low vision work is professional paternalism. I only see 8 patients a day. After 4 patients in the morning, I need to take a siesta. When I get home at night, I am tired. But I can tell you, it is a great thing as a doctor to be able to talk to people for 20 minutes, and I think this is crucial in the low vision field. If you, again, talk to people in the support group and you say, well, what is low vision rehabilitation? You'll often hear hope, help, it's healthy, it's happiness, and it's the till then. So when you don't have cures, this is what the people are saying. Well, what do I do till then? I love to think of the movie, the Apollo 13 movie with Tom Hanks, when he's stuck up there and they break apart and he can't get back to Earth unless he works with the parts they have. In a way, maybe that's low vision rehabilitation. So where do you get this low vision rehabilitation? Well, first of all, CMS, Medicare, has stated that optometrists and ophthalmologists supervise the low vision rehabilitation team. But truly, those of us that have worked in the field realize that there's all these professionals that make up the team. And the best team, I think, is when they work together. Maybe I've got a little diagram of a group called the A-Team that really stirred the pot a few years ago. I was part of that. when you heard the name A-Team, I think they thought we were all legends in our own mind, but it was that we got AER, AOA, AAO, and AOTA, all to sit down and talk about, is there a model that we can all work with? And we actually did come up with one. I think that model still has a little work that needs to be done, but I think the idea of everybody working together in the best interest of people with vision loss is the right way to go. If you look back in time and say, ooh, now, who actually are the players? Who's on the scorecard for working in the vision rehabilitation field? I think one that you'll find out that more and more residencies in ophthalmology have low vision services. They're training the residents. That's one job I have. I think you'll find out, and this might shock you, that the optometric curriculum has had low vision in it for over 50 years, that there are residency programs for optometrists. This is post-grad for a year. Maybe someday we'll have a fellowship in ophthalmology. It might be part of retina, where there'll be involvement with low vision. There are obviously university-trained rehab teachers, low vision therapists, O&M specialists, and they've been at this for over 50 years too. So now we have occupational therapists that are very helpful in this field, and on this list goes. There's a lot of people very eager to work in this field. I'll let you know, too, that there's standards in this field. I happen to work with a group called NAC, the National Accreditation Council. NAC is trying to grow. It's trying to get as many people on their board, consumers with vision loss, as well as the different professionals, and carve out really cutting-edge standards. CARF is a group as well that's working with the VA and with agencies. I'll tell you that for me, there's a lot of groups that make a difference, and I've got a list of them up here. I've had the good luck to work with Vision Serve. Vision Serve is a group to reckon with. They have over 100 members. These are the EDs, CEOs of different agencies that serve the visually impaired and blind. You heard me talk about NAC, the professionals, AMD Alliance International is a great group. Lions Clubs Internationals. There's so many different groups that are focusing on low vision. It's easy to just Google some of these in, and I'm not even hitting half of them. There's so many good support groups, on and on the list goes. So this will date me. Does it help people with vision loss to have low vision rehabilitation? And I say, you bet your sweet bippy. So at any rate, I would just share with you that my experience over 30 years is that if you get in a good, comprehensive, accredited program, it works, it helps, it's healthy. Barriers. Well, maybe one of the barriers is just getting people to say if there's not a cure, the next best word is improvement. But there's so many psychosocial things, again, that maybe people just can't get past that first step. So it's so important that the professionals make referrals for timely low vision rehabilitation. When you have a person that you know has a diagnosis of vision loss, they should be immediately referred for low vision rehabilitation. Early intervention is a key for rehab. Now, I would like to also say that when it comes to people that I work with, I view them in the most positive way as apprentice carpenters. In other words, they come to me with an empty toolbox. And I almost start to drool when I see that they don't have so many of the tools out there that can really help them. Talking about tools, let me tell you, there are a lot of exciting tools that can help people see better, but many of them fall under prescription. You need to go to professionals that know how to prescribe and help you learn the right tools for you. So 5 ways to improve near-point spotting abilities. Might be stronger reading lenses, prescription magnifiers, reading machines, assistive technology. Just get large print checks. There's so many things. Good lighting. Carry a light in your purse or in your pocket. 5 ways to improve distance spotting, eccentric viewing training. When you have a big scotoma, blind spot in your eye, learning how to work around that. I think also finding out, are there glasses that could really help me see? Are there glasses that might have telescopes? You mean to tell me, Dr. Williams, that there's over 40 states that allow people to drive with telescopes? There's a lot of things out there that our culture just isn't aware of. Video magnification. I was part of the Johns Hopkins early study with that thing called Elvis. I'm not talking about the guy from Memphis, but I'm talking about this head-borne thing that was a camera, and oh boy, it was really out there. But from the ashes of Elvis have come so many new things. So I've learned to be a doctor that keeps one foot on the ground and one foot off the ground. My foot on the ground might be my scientific, pessimistic side, but my foot off the ground is the hope that the mother of invention might come from many different places. I'll tell you the most exciting things that are happening right now are all these assistive technology things. There are so many reading machines out there that can improve reading speed. There are portable ones now that you don't have to worry about lugging around, that you can just put in your pocket, and they might help you shop, see menus, see programs. And the price is getting reasonable, so there's opportunities. And how about the capture to speak? Sometimes you have to get vision from your ears. In other words, if you have devices that can actually capture things, you can take your time to blow it up or actually hear what it has to say. We're leveling this playing field for people with vision loss. All the low vision assistive technology categories out there: computer screen magnification, screen reading, access to print via scanning, voice recognition, job opportunities, being competitive in the classroom. And what about the tablets? All the new tablets. I still am. Well, let me tell you, on my staff of 14, I have a certified assistive technology specialist that is working on me all the time. I finally got an iPhone, and I'm telling you, there are so many wonderful apps now, and they're going to keep on coming out. And they're so exciting to help people realize that you're not defined by your vision loss, but by your heart and your head. All right, that's it. I'm glad it's over because my voice is just about worn out. I've been screaming for the White Sox, who haven't been doing so well the last 2 days. But I'll tell you that, obviously, we need a lot more research. You saw this slide with how much research is going on in low vision. I'll tell you that we must accept that low vision is a treatment modality, and it's the continuum of eye care when people have vision loss. And when there's no vision to be used, then it's blind rehab. And that's it. Thank you so much for having me today.